Imagine waking up feeling fine. And just days later, finding yourself in a hospital bed, facing a stroke or heart failure. Sound dramatic? What if I told you a common respiratory virus could silently be behind it? Here's the shocking part. New research suggests that RSV, a virus most people think only affects infants, might be a serious hidden threat to your heart. Today, we're uncovering how one common virus, RSV, may be silently increasing your risk of stroke and heart failure, especially if you're over 60. We often hear about RSV, or respiratory syncytial virus, in the context of infants and toddlers. Pediatricians warn parents every winter season, schools send home letters, and hospitals prepare neonatal wards to handle the influx of respiratory infections. But here's what most people don't know: RSV isn't just a childhood virus. In recent years, medical experts have started sounding the alarm. RSV is silently affecting adults, especially older adults, those with weakened immune systems, and people with chronic conditions like asthma, diabetes, and cardiovascular disease. And here's where it gets deeply concerning. New research has started to connect the dots between RSV and far more serious complications, not just a cough or shortness of breath, but life-threatening events like stroke and heart failure. Yes, you heard that right. A respiratory virus that you might brush off as just another seasonal bug could be putting invisible pressure on your cardiovascular system, raising your risk of ending up in the ER with something as serious as a blocked artery or heart failure. This revelation has left the medical community scrambling to understand the full picture. Why is RSV, a virus we've long considered mild or only dangerous for babies, now emerging as a major threat to adult heart health? Why are so many people experiencing cardiac symptoms shortly after recovering from a seemingly harmless infection? And more importantly, what can we do to protect ourselves and our loved ones before it's too late? In this video, we're going to peel back the layers of this mystery. We'll uncover how RSV affects the heart, explore shocking data from recent studies, and share stories that might change the way you think about just having a cold. Because sometimes, it's not just a cold. Every year, millions of people catch RSV without even realizing it. They feel a bit run down. Maybe a sore throat. A slight cough. Some shortness of breath. They assume it's allergies. Or just a cold. They push through their day, go to work, make dinner, take care of the kids, business as usual. But days later, or sometimes even weeks later, something more sinister starts to happen. They begin to experience chest pain, palpitations, extreme fatigue, or sudden swelling in their legs. Some brush it off. Others rush to the hospital. And that's where the shock hits. They're being diagnosed with heart failure or are told they've just had a stroke. How? They ask. I was just getting over a cold. I didn't think it was serious. This is the chilling part, neither did the doctors, until recently. Traditionally, when we think of heart failure, we think of lifestyle factors: poor diet, high cholesterol, lack of exercise, maybe smoking. When we think of stroke, we blame hypertension, obesity, or genetics. What we don't think about is a virus, especially not a common one like RSV. But that's the problem. There's a growing body of research now suggesting that RSV isn't just a respiratory issue. It's becoming increasingly clear that it can trigger systemic inflammation in the body. And inflammation, especially when it becomes chronic or unchecked, is a direct assault on the heart and blood vessels. Think about it: your heart is already under pressure if you have even slightly elevated blood pressure or a bit of arterial plaque buildup. Now, imagine layering that with viral inflammation, reduced oxygen flow from a lung infection, and a body fighting off viral invaders. It's like setting fire to an already cracked foundation. And the people most vulnerable? Older adults over the age of 60. Those with existing cardiovascular conditions. People recovering from surgery or illness. And those with weakened immune systems. These individuals aren't just getting colds anymore. They're facing life-altering medical events because of an overlooked virus. To make matters worse, RSV often flies under the radar. Unlike COVID-19 or the flu, many people aren't even aware they've caught it. There's no standardized testing at clinics unless someone is severely ill. Which means, we're underdiagnosing and underestimating its impact, especially in the context of heart health. And that leads us to the critical question. How exactly is RSV doing this damage? What's going on behind the scenes, at the cellular level, that could link a cough to a clogged artery? Or a fever to a heart attack? Let's dig deeper. Let's take a closer look at what's actually happening inside the body when someone gets infected with RSV, and why it's becoming a serious red flag for both stroke and heart failure. It all starts with the lungs. RSV, or respiratory syncytial virus, is known for targeting the lower respiratory tract. It inflames the bronchioles, clogs airways with mucus, and reduces oxygen exchange. Most people associate it with coughing, wheezing, and trouble breathing, but that's just the surface. What many don't realize is that this infection triggers a massive immune response throughout the body. Think of your immune system like a military defense system. When RSV invades, your body calls in its elite forces, cytokines and inflammatory proteins, to fight off the virus. This response is supposed to be helpful. But in some people, especially older adults or those with weakened hearts, this inflammatory storm spills over, wreaking havoc on other organs. And the heart. It's the first line of collateral damage. Here's how it happens. Inflammation damages blood vessels. The same chemicals the body releases to fight RSV can cause swelling and damage to the lining of blood vessels, making it easier for blood clots to form, which can lead to strokes. Oxygen levels drop. RSV causes congestion in the lungs and reduces oxygen levels in the blood. The heart, in turn, has to work harder to pump oxygen-rich blood to vital organs. For someone with pre-existing heart conditions, this can push the heart into overdrive, and eventually failure. Stress on the heart's electrical system. In some cases, RSV has been linked to arrhythmias, irregular heartbeats, which can trigger sudden cardiac events, especially in vulnerable individuals. Immune overreaction. In rare cases, the body's immune response can even attack healthy heart tissue, leading to a condition known as myocarditis, or inflammation of the heart muscle. This can severely impair how well the heart pumps blood, and if left unchecked, it can lead to long-term heart damage. Still think it's just a cold? Recent studies have even uncovered direct links between RSV and elevated levels of cardiac biomarkers, proteins in the blood that indicate heart stress or injury. One alarming study showed that RSV patients were more likely to be hospitalized for heart failure within weeks after recovering from the infection. And here's where it gets even more concerning. These issues aren't always immediate. In some people, RSV may appear to come and go, mild symptoms, maybe a little fatigue. But the internal damage can linger for weeks or even months, silently straining the cardiovascular system until something finally gives, a stroke, a heart attack, or heart failure symptoms that seem to come out of nowhere. This is why experts are now urging early detection, targeted treatment, and most importantly, awareness. Because if RSV can spark this level of damage without anyone noticing, then we're dealing with a hidden epidemic inside the pandemic of heart disease. And just when you think it couldn't get any more serious, wait until you hear what researchers just uncovered in their latest findings. Let's go there. One recent study tracked over 8,000 adults hospitalized with RSV, and the numbers were staggering. Nearly 1 in 3 of them developed serious heart complications, and a significant number experienced stroke-like symptoms within weeks of infection. Even more alarming, many of these patients didn't even know they had RSV until it was too late. Imagine thinking you just had a cough or cold, only to end up fighting for your life in a cardiac ICU. So, what can we take away from this? RSV is no longer just a pediatric issue. It's a serious cardiovascular threat, and one that's still flying under the radar for most adults. If you or someone you love has a history of high blood pressure, heart disease, or diabetes, this virus could pose a much greater risk than previously believed. Protecting yourself isn't just about avoiding a cold, it could mean preventing a stroke or heart failure down the road. Have you or a loved one experienced unexpected complications after a respiratory illness? Share your story in the comments. We'd love to hear your experience and bring awareness to others. And don't forget to check out our next video, where we uncover the silent symptoms of early heart disease you might be missing right now.